Hi, welcome to our channel of IGNOU audiobooks. Indira Gandhi National Open University, School of Health Sciences, SOHS, Diploma Programs, Diploma in Nursing Administration, DNE, BNS11 Principles and Practices of Nursing Management, Block 1 Principles of Nursing and Public Administration, Unit-1 Concept, Philosophy, Purpose and Scope of Nursing and Public Administration. 1.0 Objectives. After completing this unit, you should be able to define and explain the meaning of administration, describe the concept and philosophy of nursing and public administration, state the objectives and discuss the purposes of nursing administration, and explain the scope of nursing and public administration. 1.1 Introduction. Organizational goals and objectives require appropriate administration and management. Nursing administration is practiced everywhere with the globalization of healthcare. We have moved past the traditional models of care settings to a wide variety of settings, namely at home, in the neighborhood, in the military, in acute care settings, in rural area, in sports and anywhere else imaginable wherever humans live. Nurses have the major responsibility of providing all the care that a client needs and has the right to expect while undergoing the treatment and nursing care. The quality of nursing services largely depend upon the effective use of the available team of nursing and non-nursing manpower and resources. Today the emphasis is on human development so that each one acquires personal responsibility for delivery of care to the client. The delivery of healthcare as it largely depends on the type of administration. It is essential for all the nurses to understand the concept and philosophy underlying the nursing and public administration and should be able to explain the purpose and scope of administration, which are elaborated briefly in this unit. 1.2 Definition of administration. Management and public administration. Administration. The word administer is derived from the Latin word ad plus ministrare, means to care for or to look after the people, to manage affairs. Administration is a process permeating all collective effort, be it public or private, civil or public administration, military, and is universal in nature. It is a corporative effort directed towards realization of a consciously laid down objective. Since administration permeates all planned human activities, hence it is at the center of all human affairs. Its principal aspects are formulation of policy and its implementation for the attainment in an optimal manner of stated ends in the shape of service or products. Administration is the organization and direction of human and material resources to achieve desired ends. Pfeiffer and Priesthus. Administration is determined action taken in the pursuit of a conscious purpose. It is the systematic ordering of affairs and the calculated use of resources aimed at making those things happen which are wants to happen and forestalling everything to the contrary. Marx. Administration is the direction, coordination and control of many persons to achieve same purposes or objectives. Administration has to do with getting things done, with the accomplishment of defined objectives. Luther Gulick. Administration is an enabling process. It concerns the whole art of carrying into effect any policy plan or undertaking, whether considered by government, public or private agency. Goddard. Management. Management may be defined as a process of putting administration into practice. Management is the process by which a cooperative group directs action towards common goal. Joseph Mercy. Management is distinct process consisting of planning, organizing, actuating, activating and controlling, performed to determine and accomplish the objectives by the use of people and resources. George, 1988. Administration and management considered as synonyms. In any organization, there are two types of functions, i.e., administrative functions and executive functions. Administrative functions are entrusted to top-level managers or administrator, includes planning, organizing and planning for staffing. Executive functions are entrusted to middle and first-level managers or supervisors, which includes actual staffing, directing, coordinating and controlling. Usually administration includes thinking function involving formulation of objectives, plan, policies which rest with top-level administrator, whereas management includes operative functions, i.e., a doing function involving executive functions which are under the control of middle-level and first-level managers. So we can say that the administration is an enabling process for achieving the laid down objectives of an organization through formulated plans and policies, whereas management as a process of putting administration into practice or effect. 1.3 Concept and philosophy of nursing administration. Nursing administration involves the implementation of policy, which has been outlined by the selected representatives of the health and nursing. The health policy enunciated by policy lawmakers provides the framework within which nursing and public administration work. The law, rules framed under the law, become the basis of administrating authority. Policy and administration are two sides of the same coin, and it is difficult to say as to where health policy ends and administration begins. The modern concept of adequate client care interprets total client needs, whether these needs be diagnostic, preventive or therapeutic, physical, psychological, spiritual or social. It recognizes the client as a person with an individual personality and with individual needs, who has come from a recognized place within the family and the community. The individual must be helped to adjust to his or her condition and new environment. The ultimate objective of adequate client care is to return the individual to his family and community, restore to health and productive capacity. In same instance, the client is prepared to adjust his or her living to their physical potentialities. This broad-based social concept of total client care has many implications for the nursing department, its activities, competencies, and attitude of the nursing staff. Nursing department is assigned the specific responsibility of providing for safe, adequate, and satisfying client care through the medium of quality nursing. The department is the general professional service unit of the hospital, to which is delegated the administration the responsibility for the organization and administration of the nursing service of the hospital through its director. The overall purpose of nursing service administration is to attract and retain competent professional nurses and other ancillary personnel. This way, nursing services can be effectively and economically achieved and constantly improved to provide those services which contribute to the health, development, efficiency, and contentment of personnel. The primary function of the nursing department is nursing service, which includes direct nursing care provided by nursing service personnel. Nursing services also include activities like administrative details involved in caring for the clients admitted, keeping the record, indenting supplies and equipment. Any consideration of the conditions which are essential for a good department of nursing must begin with a brief reference to hospital or health agency of which it is a part. The hospital purposes, activities, organizational structure and administrative policies determine nature and scope of its nursing services. This leads you to further understand the philosophy and objectives of nursing administration. 1st March 2001 Philosophy of Nursing Service Administration. The philosophy of nursing service administration is made up of the benefits and values that directly influence the professional practice of nursing within the healthcare setting. The basic purposes of nursing services are to provide meaningful work environments and quality nursing care to the client. The philosophy of nursing services should be reflective of the overall institution's purposes and philosophy statements. The philosophy underlying administration of nursing services is based on following features: interrelatedness. Constant and careful attention is given to interrelated factors like quality, quantity, time, cost of work, available resources necessary to reach the objectives of the organization. Limitation in the available resources can be a major obstacle to improvement in the delivery of health services. Factual evidence, obtainage: factual evidence in evaluation, execution and control of work plan helps to avoid wastage of resources at any level of administration, local, national, international, and to take decisions on the basis of verifiable facts. Verification of facts helps to avoid errors in administrative actions. Delegation of responsibility, placing the responsibility for the decision at the lowest possible organizational level helps to attain decision as speedily as possible. A clear display of authority and responsibility of each member of the team according to his her position and efficiency helps to avoid confusion and conflicts. Individual and organizational goal: administration is deeply concerned with human relation. The function of the administrator is to obtain an established objective through the management of people. Good morale of staff is essential to achieve success. The major thrust of nursing service administration is to achieve both individual and organizational goal by financial and other staff welfare activities. Healthy human relations affect the work performance and morale of the members. Effective communication: proper flow of communication is needed in all the related and interdependent components of a system to maintain balance in all networks. Communication occupies the central part in a dental administration and travels both vertically is from the top down and from bottom up, and laterally. The communication travel to and from the nurse executive by virtue of telephone writer, material, computer printout and meetings. The basic purpose of communication is to effect change in our environment, in others, and in ourselves. Flexibility: one of the most important elements of nursing service administration is to meet and adapt to the changing need of the organization, community, individual and society in general. Flexibility within the organizational policies permits change in schedules and routines that in turn boosts the morale of the staff, improves efficiency, generates interest, and is educative. The philosophy of division of nursing is developed as a statement of value and beliefs that underlie the purpose and the way in which it is to be achieved. Cantor states that thoughtfully prepared statements of purpose, philosophy, and objectives based on reality, understood and used by those responsible for implementation, can promote efficiency and effectiveness in the operation of institutions, departments, and programs. Statements lacking these qualities are merely collections of words. The task of nursing administration is to redesign rather than develop original statements. In order to determine and appropriate organizational structure, one should understand the purpose, philosophy, goals and objectives of the organization. It is important to design a philosophy that is congruent with the organization's purpose and philosophy. Sample statements of philosophy of nursing. Service administration in a hospital or community setup are given in Annex 1. Some of the statements of the philosophy that are common to nursing department in various kinds of health organizations are given below. Administer safe, high quality, cost-effective care to clients, family and community. Provide an environment for promotion and maintenance of health for all individuals. Maintain an environment motivating the development of nurses by way of in-service, continuing education, research activities and promoting their career. Direct nursing interventions that are individualized and most effective when directed towards clients' health goals, coordinated with other health team members. Deliver high-quality patient care services that can be provided by coordination of a team of medical, nursing professionals and non-professional personnel with a need. Designated structure i.e., health agency. The philosophy should be evaluated for usefulness and thoroughness using various criteria. The following criteria is suggested for general applicability. Reference is made to the purpose of the nursing service. Terminology used is understood by nurses, clients, and others. The philosophy is concise. Statements of beliefs BD values are included. 1st March 2002 Objectives of Nursing Service Department. Based on the philosophy laid down for nursing service administration contributory. Objectives can be drawn. For the sake of specificity and clarity, objectives may be classified under 5 headings given below. Objectives for the delivery of client care. Establishment of physical environment. Establishment of conceptual environment. Achievement of individual objective. Contributory individual objective. Keeping in view the above classification, some desirable objectives in the nursing service department are given below. To render high quality of nursing care in which the physical, psychological, spiritual, and social needs of client are met. To carry out therapeutic measures or ordered by the physician with intelligent application to the needs of the individual client. To make studies related to nursing care and nursing service in order to improve the quality of nursing and the effective utilization of personnel. And to formulate and recommend policies for the improvement of the care of the clients. To cooperate WLTH all the departments of the hospital in achieving the total purpose of the hospital. To participate in all programs of education and research that the hospital may carry on, which involve nursing service activities. 0. To support and promote hospital policies and regulations. To foster and maintain good relations through its personnel both in their functional capacities and as individual in the community. To promote good personal policies and practice to further the self-development of all the group within the department. To participate in overall planning for meeting the total needs and improving the care of the clients. To employ sufficient nursing personnel to give safe, adequate and satisfying care through the 24-hour period under competent supervision. To maintain and develop good standards for developing learning skills of students. To mingle and participate with other professional organizations. To evaluate the nursing services periodically. These objectives are the nursing department of a healthcare institution, so it is the responsibility of the nursing administrator to see that they are achieved. 1.4 Purpose of nursing administration. The main purpose of administration is to facilitate or help the functioning within an organization and maintain a high standard of performance. The nursing administration should aim for quality care for which the administrative and operative functions should be geared towards the smooth running of nursing service concerned departments. The nursing manager, in order to maintain a congenial work atmosphere, should try to see that she facilitates with all the necessary arrangements, services to his personnel for achieving the organizational and professional objectives. Scope explains the coverage or the extent of activities, functions. In other words, it describes the extent of its app. IK tilde s. Are shared tilde hips with other organizations or other Departments. 1.5 Scope of Nursing Administration. Nursing administration is a part of the health administration. As mentioned earlier, nursing is practiced everywhere, namely hospitals, community health centers, home, military, sports, space, and industrial units, and anywhere else wherever humans live. Broadly, we can also divide the areas of nursing administration into nursing service, both hospital and community health agency, nursing education, and nursing research. Nursing administration covers actual conduct of nursing care activities related to client care, training and development of students' manpower, and related to planning and improvement of nursing services. In its narrow perspective, it only relates to the activities of the administrative branch of nursing services. Keeping in view the vastness of settings where nursing is practiced, we can say that the scope of nursing administration refers to the direction, control, and coordination of all the nursing personnel working in the various setups. The big task of administration of all the nursing population is achieved through the establishments of nursing service departments working in consultation with their governing body, government, central, state, district, local, and private, corporate sector, enterprising units. Institute of Nursing Education are governed by the rules and regulations established by registration councils, i.e., state councils. State councils function with state health policy and laws laid down by National Registration Council, e.g., Indian Nursing Council, INC. Scope of the nursing administration also encompasses the activities of the formally convened associations of nursing persons, e.g., state association branches of nurses. The associations are also formed of special ended groups of nurses like cardiac, neurology, obstetric, midwifery, pediatric, etc. The associations have a participative role in the overall administration of nursing services in any organization. Nursing administration also has scope within the realm of international health policies, as the nursing policies take into consideration the declarations made by agencies like World Health Organization, International Council of Nurses, IC, American Nurses Association, ANA, National Leave for Nursing, NLN, etc. The declarations are integrated and adopted into the local policy of nursing practice and education, for example, Health for All through primary health care. Lastly, we can say that the scope of nursing administration is accepted in the spirit of interdependence, collaboration, association between the BM, the areas of practice, education, and research. As the definition of administration entails achievement of desired goal with the actions of group of people, then the scope of nursing administration lies in teamwork. Teamwork develops with networking together of professionals and non-professionals, where each one functions according to his ability but participates in achieving the goal of quality nursing care. Therefore, teamwork is necessary at all levels of administration. 1.6 Summary. In this unit you have studied about the meaning and definition of administration and management. You are also helped to understand the concept and identify the philosophy of public and nursing administration. The unit also explained the objectives of nursing service department. In the end, you have studied about the scope of nursing administration from which the functions or elements of administration can be derived, which you will be studying in the next unit. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.